I'm Mabel John. You're watching continuing coverage of the World Healthcare Congress here in Washington, D.C. And we're talking about destination travel for healthcare. In the studio right now is Keith Pollard. He is managing editor of the International Medical Travel Journal. He's based in the UK. Keith, thank you so much for stopping by.
Thank you.
Is it a growing industry, medical healthcare travel?
Yeah, I mean, what we've come here for, we run an international event that generally is within Europe. And so what we've done this week is we've literally come for our international event in Croatia with people from 30 plus different countries around the world to partner with WHCC to talk about some of the issues surrounding medical travel, both within the USA, so a kind of growing area of domestic medical travel where patients kind of are more flexible about traveling within the USA for treatment, but particularly about the US role in attracting international patients into its hospitals.
Okay. So I live in Boston, which is a fantastic city for healthcare. Why would I need to travel outside of the country for medical needs? Yeah,
I think you've got two aspects. So there may be people in Boston who have health insurance or employee paid healthcare where there are deductibles, co-pays that make healthcare very expensive. So as a citizen of Boston, well, you may not have insurance at all. You might consider traveling south, probably, Central America, Latin America, Costa Rica, Panama, countries like that. But within Boston, you have, for example, the Boston Children's Hospital, which is one of the best known and the best quality children's hospitals in the world. And that hospital itself will generate, my guess, probably $60, $70 million for that hospital by attracting children from all over the globe who are coming for the best healthcare.
Okay. Now, in terms of people traveling outside of their home states for care, what are the benefits that some of these destinations can offer that they might not? You had mentioned a couple, if you don't have insurance, or maybe the benefits are too expensive. Why is it less expensive to go someplace else, perhaps?
As we know, the US has an expensive healthcare system. You know, the numbers say your healthcare system costs twice as much as our National Health Service in the UK. So, you know, very simply, for some people, you know, if they need anything from dentistry to IVF to a hip replacement to heart surgery, you know, they will travel because it may cost them 50% of the US cost, or maybe less in some cases.
Okay. You have just done an event in Croatia.
Yes.
So what are some of the opportunities there?
Croatia is an interesting market. It's one of the nations that wants to develop its international business. It already has significant, what we describe as cross-border business. So we took an American dentist to one of our award-winning dental clinics in northern Croatia, and it's on the border with Italy. And he was stunned because we went into this dental clinic where there were 40 dentists. This is big, 40 dentists in one clinic. That opens at 5:30 in the morning. And he asked the lady there, he said, well, how many patients have you got booked in today? And she got her flip chart out, and she said, and he went, Jesus. And then she turned the page, and the page, and the page, and he said, how many patients? And that clinic in Croatia just treats Italian patients, because Italian dentistry is expensive. They literally get on a bus, these come in coaches. So a coach leaves Milan at midnight, travels across the border, 5 hours, arrives at this clinic at 5:30 a.m. and 140 patients are treated over the day.
Wow.
And it's a big business. I mean, it's similar to the cross-border travel from, Americans in the southern states going into Mexico to get their teeth fixed. That's one aspect of medical travel, but it's a very complex market with lots of flows from one country to another, cross-border or even greater distances.
And these are local physicians?
Yes, yes.
Local Croatian dentists?
These are Croatian dentists who are providing their services specifically for the Italian market. And what they're looking to do, is to grow more business from other European countries.
Is the training of the local physicians as good as you would have in a place like the United States?
I think the answer is yes. That most of those doctors, dentists, surgeons who get involved in medical travel are usually the best in their country. They've often qualified, studied elsewhere. So particularly, in Europe, a lot of the surgeons who get involved in medical travel or within the Middle East have trained in the US, have trained in Europe, have trained in the UK or Germany or something. So people say, well, would you trust a Croatian dentist? I would. If you think about it, this particular clinic, they put dental implants into your teeth.
Okay.
This clinic puts 12,000 dental implants in
just from the sheer experience of
sheer
doing
volume.
it.
They put more
yeah.
dental implants in than probably any clinic anywhere in the US.
Right.
So, this sheer volume of numbers and expertise they develop is massively impressive.
Let's touch on YouSkip. Can you?
Yes.
I'll allow you to break apart that acronym for me.
Yes. YouSkip is the United States Cooperative for International Patient Programs. It has some government funding. It's based out of Rush University, and it's an initiative that's been in existence, I think, for probably 5, 6, 7 years now. And what they've done is to bring together around 70 of the leading US hospitals, like the Mayo Clinic, the Cleveland Clinic, like the Boston Children's Hospital, hospitals that have, that are leading hospitals that have international patient programs that bring revenue into the US.
Right.
And we have a very good relationship with them. They came to our summit in Madrid last year. They came to Croatia. They did an excellent presentation. They don't get that much exposure at events in the US. So we incorporated them. It's very important to have them involved in our program at this Congress.
Right.
Because they're the people who are making it happen for the USA. It's an impressive, it's a good organization, some great people within it.
Oh, great. Well, Keith, thank you so much for stopping
welcome.
by. I appreciate your comments.
Thank you, Mabel.
Thank you.
Thank you.
And thank you for watching. I'm Mabel Jong. Still to come, comments from Health Edge.